All right. Hi, everyone. Thank you so much for coming to the Medica Zone's Becoming and Being event. My name is Abhi Venkatesh, and I've been an outreach intern for about a year now. I'm joined by Saba Al-Kabi.
Hi guys, I'm Saba. I've been an outreach intern for about a year as well, and more recently the outreach coordinator for a few months. I'm really excited to be here and help host this event.
So, okay. So this event is sectioned out with prompting topics, followed by a few leading questions asked by me and Saba. During this time, the audience is encouraged to ask their own questions, as this is more of a roundtable discussion format. The questions from the audience can be typed into the meeting chat and we will read them out loud as we get to them. Please note that the event will be recorded and posted on the MedicaZone YouTube channel, which is linked also in the meeting chat. So we will start off by introducing our guests today, Dr. Gaffney Adams and Dr. Haydel. Dr. Gaffney Adams, would you like to start off by talking a little bit about yourself and your medical journey?
Okay, sure. I'm Dr. Alexea Gaffney Adams. I am a triple trained and board certified infectious disease specialist. I took a very typical and straightforward path straight from undergrad into medical school. I went to medical school at SUNY downstate in Brooklyn, New York, and then I went to school to be a pediatrician, somehow fell in love with adults, and I did a combined internal medicine and pediatrics residency. And then about halfway through my residency, I realized that primary care wasn't the only thing I thought I was going to be up to. Because after saying I was going to be a pediatrician, then I said, I'll just be the world's greatest primary care doctor and I'll take care of everybody. And went on to do an adult infectious disease fellowship. So currently, my practice is mostly infectious diseases. It's about 65-35, with the remainder being primary care. And I love what I'm up to. I work in a private practice setting. My practice is hospital affiliated. I am a solo practitioner, which is interesting. And I've had a lot of personal twists and turns in my life, which we can get more into, that have really, I wouldn't say changed the way I practice, but let me know that the way that I show up as a provider is the right thing to do for patients, because I have been in and continue to be in the patient seat managing a chronic illness. And that's led to all sorts of other amazing things outside of medicine that I didn't even realize I could be up to. But I'll stop there. Thank you.
All right, thank you so much. Dr. Haydel, could you let us know a bit about yourself?
Yes, so my name is Torhiana. I mainly go by Tori in like an academic setting. I'm from Lake Charles, Louisiana, which is this smaller city that's like 2 hours from Houston, Texas, and 2 hours from Baton Rouge. I graduated high school in like 3 years. Then I went straight to college at Xavier University of Louisiana in New Orleans, which for those of you who don't know, they are the number one producers of African Americans who go on to complete medical school. So I went there with the hopes, of wanting to be a doctor. I had this whole plan that I'm going to go straight from undergrad to med school to being a pediatrician. And then life has a way of like changing all of that. So the MCAT was my biggest struggle. My extracurriculars were fine. My GPA was fine. But the MCAT is where I kind of fell short. And I would say that was really rough, like especially for people who are like in undergrad now. I just want you guys to know that like it's okay if you don't do well on like your first attempt at the MCAT. And so I always had this idea of doing a dual degree. So whenever I first applied to med school, I got waitlisted, then accepted. And so I took that year to get a MHA, a Master's in Healthcare Administration, just because I've always loved business. And unfortunately, like healthcare in this country is a business. So I felt like it was really important to kind of like know the back ends and how do we get paid just for my own interests. So I graduated from Xavier in 2017. Then I got into medical school in 2020. I applied to medical school 3 times. I would say the second time I probably shouldn't have applied. I was just applying. But on my third time, I got into med school And I got into an osteopathic medical school called Edward Baya College of Osteopathic Medicine. It was the first DO school to come to Louisiana, which I felt was really kind of like aligned because like Louisiana was the last state to grant osteopathic medicine doctors the ability to practice. So I thought about like more so like a longevity and like a legacy type thing when choosing my med school, like being from the state, this first med school, stuff like that. Um, and then came in wanting to be a pediatrician. If you would have asked me, I would have said I would not have wanted to be a psychiatrist. Like I knew I didn't want to do that. And it was my third year of medical school doing my psych rotation where I really connected with child psychiatry, but at the same time loved my peds. So I knew one person who went on to be triple board trained, ped psych and child psych. So I had that in the back of my mind. And I always tell people the funniest thing is that when I saw her post that she had matched triple board at the time, I literally said, who would ever want to do this? So it's always like, be careful what you say because sometimes you eat those words. And so I applied to both triple board and pediatric residency programs just because it's only 11 triple board programs. And then, yeah, now I'm here. I'm currently at Cincinnati Children's, learning to be a great pediatrician, and I'm about to start adult psych in July. So excited for the transition.
Right, that's great. Thank you. So I will start off the discussion with a couple of general questions for both of you. We'll start with Dr. Heidel. Um, we know that medical school itself is a very rigorous pathway for any specialty. So what were some of your habits and practices that helped you from not burning out before you graduated?
I would say, like going into medical school, what I thought was very important is that like recognize at the beginning what you did in undergrad kind of just may not work for medical school. Some of the things may work, but some things might not. For some people, myself included, I took like handwritten notes in undergrad, but with medical school, it's like so much information that like you really just do not have time to like handwrite everything. Maybe a few things like points that you need to drive home. So like recognizing that early on is that like things that worked previously might not work in this current moment. And then also what might have worked for anatomy might not work for cell bio or might not work for neurology. So just having like that open mind. And then recognizing, which is hard to do, like it's really hard to recognize when you're getting burnt out. But I think some tips or things that I recognize on myself was that when I was board studying, that's really when I started to get burnt out. Not necessarily like the first 2 years, but like board studying, I recognized that like I was making simple mistakes. Like when I'm practicing, it's just like, oh, questions, I'm getting them wrong because just like mentally I'm checked out. And what I did from that point was made sure that like I had at least one day where I had a rest day. I'm like, I can study 6 days a week. I can have one day off and still pass my test or still do well on my boards. Um, just to make sure I'm in a right mind frame and recharged.
Thank you. And the same question for you, Dr. Gaffney Adams.
So I entered med school burnt out and depressed, and I didn't recognize that I was. So I really struggled my first year of med school, and I actually ended up repeating my first year of med school. I burnt out because in undergrad um, I did everything. I always had way more credits than I needed to be taking. I worked in a research lab. I had a work study job. I had a job off campus. I did hair. I was doing everything. I was traveling to present my research at conferences, and all of that is incredibly important and it's necessary for your entrance into med school. But I also came out of undergrad grieving the loss of my grandparents. My grandfather died like within a month of me entering med school. And I have been one of his caregivers when he was dying from cancer, and I was going through a personal health stressor. And so navigating all of that, and I had one plan, which was I was going to move to Nashville, Tennessee, which is where I went to undergrad. I went to Fisk University. Shout out to HBCUs. Um, and I was going to move to Nashville and go to med school at Meharry Medical College, but I got accepted off the wait list. So my whole med school entry plan trained, and I just really came in burnt out. I also found out the hard way, the way that I studied in undergrad did not work in med school because it was just too much information to retain. So what I would say is if you find that you're struggling, whether it's mentally, emotionally, or academically, or a combination, because usually where one goes, the other is going to follow, seek help immediately. Seek help within your school. There will be school psychologists, your guidance counselors, students that are more senior to you, like find out who's been in this position, what did they do, and what tools and resources do you need. So in my first year of med school, I worked really closely with the school psychologist. I had a lot of situational anxiety around testing, which I'd never experienced before, not as a high school student, not as an undergrad student. When I had failed an exam, I was given an opportunity to see what went wrong. And literally, because of my stress, anxiety, and just not being confident in myself, I had like erased my way to a failing grade where I had really passed the exam originally. So I worked with the school psychologist on coping strategies. I worked with a psychiatrist in a nearby practice and got treated for um, longstanding undiagnosed depression. And that's something that I very openly share, not just with students or people that I'm mentoring, but I share it with my patients because, um, 1 in 3 to 1 in 4 of us is experiencing some sort of mental health issue. And if it's not addressed, it can take such a toll on our day-to-day life, our productivity, who we want to be, how we want to show up in the world. And it doesn't allow us to take care of other aspects of our health. So recognizing when things aren't going well, acting on them immediately, and really identifying trusted resources is what I say must be done. And I hope I even answered the question. I get a little long-winded, y'all.
No, thank you so much for sharing. That was
And I
very
want to add something into that last piece she said, like, it's okay not to be okay. Like, sometimes we think that, like, oh, I'm the only person going through this. Trust me, like, whether it's undergrad, whether it's medical school, you are not the only person struggling at all. You are not alone. There's someone out there who has been through it. There's somebody out there that can help you. So just when you do identify it, just seek help early.
Thank you. And speaking of mental health through med school, many people find coping mechanisms like through their journey from med school to residency. What were some of your guys' coping mechanisms that you would like to share about? And we'll start off with Dr. Heidel.
So I have a unique situation because I entered medical school with COVID. So to give you like a background, my school, the medical school I went to before COVID, they had a required in-person class. But due to COVID, we did not have required in-person class. So I was able to like do a lot of my work like from home, set like my own schedule and things like that, which I'm not type A. Like I'm very much a type B person, which you don't find a lot in medicine. So like having that flexibility to kind of like just get my work done on like my time, like prepare, do what I need to do. That was like one of my like the best coping mechanisms, like making sure to focus on like my needs, because you'll have other people in med school who's studying from 8 a.m. to 3 p.m. straight, no breaks, no food. That wouldn't have worked for me. So I made sure to like study and find times to study that best aligned with myself. And then also, I started back reading. So I've always been like an avid reader where there's like nonfiction, memoirs, And so like I made sure to take that time, especially like COVID, med school, being at home a lot. I made sure to take that time to like get back into reading for fun. You know, you could be in school and you're just reading to like learn, but like reading for fun really helped ground me. And then also like taking mini vacations. So whether it was like a weekend home when I could, my med school, after every block, we had a week off. So that was good for like coping with like stress, like you're burning out in 13 weeks and then you have that week off if you don't have to remediate. And so I would take like a trip like every week, whether it would be like out the country or just back home, just something to like just get away from the nitty gritty of medical school. So those are my two, like reading and traveling.
Yeah, that's amazing. Like our school, I feel like they tortured us. Our exams were always on like a Monday, Tuesday, or a Thursday. So you never even got a weekend off. You would go party your heart out immediately after the exam and you would get right back into it. So, oh my goodness, that's amazing. That should be the rule for med school. Um, so some of the things that I did, working with our school psychologist, I learned, the power of positivity and using positive affirmations, and mindfulness, which admittedly is a practice I lost once I got into residency and had to find it again. But I would say exercise is important, whether you like it or not, whether you're doing it for your health or whether you're doing it for your sanity. Physical exercise is definitely an important coping strategy. Taking a moment, like taking breaks. I was really bad about taking breaks. So learning to schedule in just breaks during your study day or during your school day where that's allowed. But just also in your day-to-day life, like saying, I'm gonna read this chapter and then I'm gonna go take a 15-minute walk and get some fresh air. I'm gonna answer X number of study questions and then I'm gonna do something for me. Home cooked meals was a big deal for me, because you need to nourish yourself in order to be productive and show up as your best self. And then just remembering who you are and what you love to be up to before you got into med school and before it was your job to study harder than you ever studied in your entire life. I would say that is something that is of the utmost importance, like trying to maintain something that was important to you that was not academic or not medically related and trying to build that into your life practice. And I never took a day off and I wish I did. So it's so refreshing to hear Dr. Torhiana say that.
Thank you. Now we'll open the floor to the audience members. You can type your questions into the chat and we'll read them out loud and get a response to.
I just had a quick question on, I can tell that both of you both had your own unique experiences. I'm just kind of wondering, how did you navigate like comparing yourself? I know in undergrad, like things can be very like competition based, I'd say. How did both of you kind of navigate yourselves around that and, be able to take a step back and be like, you know what, it's okay, like we're able to get through this. And yeah, I guess manage the competition that comes with just being a student in med in general.
Yeah. The I would say one thing I always remembered is comparison is a thief of joy, right? And so when you are comparing yourself to somebody else, you don't allow yourself to see what is good, great, or amazing about me, right? Focus on what you do well because, my friends and I used to do it all the time. We'd be like, oh my God, we're in this study, Carol, every single day and nobody's here. But then 1 week before the test, these folks come in and they take up all the space and they're here all day and night. How do they stay awake? We're taking power naps. We're going to get coffee, all this stuff. And then we've come to find out like a bunch of those people were like, were getting ADHD medicines from somewhere. Right. And so once I knew that, I was like, wow, like I was sitting here beating myself up because I'm not necessarily getting through a full chapter every night or because I didn't answer 1,000 practice questions this block. But you have to remember, as long as you're doing the best that you can, you're running your own race, you're on your own journey, you're on your own path, and what works for you is what works for you. Um, and you're going to be amazing at things that the people you're comparing yourself to aren't so amazing at. You know, you're going to look at people who are AOA, and nobody wants them in the operating room with them because they're maybe, and I'm not saying this is true of all AOA people, but you know, you'll have people with these accolades, or you know, they've honored every block exam, and then you get on the wards and you're the rock star clinically, and nobody wants that person on their team because they don't have great social skills. And we have to have it all as healthcare professionals to be very well rounded, but test exam that exam score is not everything you are. And remember, you're learning, right? It's okay to get the question wrong on the test, and you'll remember from that mistake when you're out there, you know, practicing on your own or practicing under the supervision of your residents and attendings, right? This is your time to make the mistakes and you can learn from them. So don't beat yourself up for not being perfect all the time, because it doesn't exist anyway. That's the reality.
And
Thank you
I
for
echo,
speaking about that.
I echo everything that Dr. Alexea just said. Also something else to keep in mind, that I think it's important to figure out what's important to you. Like whenever you're in medical school, right? Like, do you want to be a well-rounded person? Do you want to be someone who's AOA? Do you want to be someone with a great resume, meaning like you're very involved, you have the research? Some people, very few people can do it all. That's just the reality. Very few people can have the AOAs, the high pass, the resume, the everything together. And so for myself, my goals going into medical school were simply, I do not want to remediate. That was my goal in med school. I do not want to have to remediate a course, a block. I want to have that vacation time. So that was important to me, but also I'm someone who likes to be involved. So I did leadership positions. I got scholarships. Like I did those type of things that reminded me why I wanted to be a doctor. When it came to volunteering in the community, like I'm going to sign up for that. You know, like I placed higher weight on being more well-rounded, meaning I want to pass my exams, I want to pass my boards. I don't have to have the highest score in the class, but I just want to make sure that whenever somebody sees me, they see everything that's important and valuable to me. And so different people, different specialties, they have different requirements. I will never say that like if you fail every exam, you're going to be a dermatologist. I would say if being a dermatologist is important to you, then you might want to take extra care and make sure you're doing good on your exams. You might want to take the time to do research. You might want to take the time to study very hard for boards because that is what you want to do. Um, and then just making sure once you have those like core values, I feel like when you get in medical school or even in undergrad, you have your friends around you that you can trust, whether it be two friends, one solid friend, and that's who you bounce ideas off of. That's who you not necessarily compare yourself to, but that's who you talk about like your goals and your aspirations with. And with those genuine friendships and connections, it shouldn't seem like a comparison. It should seem like we both want the best for each other, and that's how we get it. And then also last thing is that when you are choosing a medical school, if you have the ability to choose, like if you like get into more than one school, think about the culture of that school. What are the med students saying, right? Are they collaborative? Are they looking out for each other? Are they sharing resources? Or is it a cutthroat environment? And if it is a cutthroat environment, will you thrive in an environment like that? Some people do, some people don't. So I think that's important to consider, like this med school culture, where it's at, how are the people doing? Are they working together? Because if you're somebody who thrives off of that environment, being at like a cutthroat comparison, this type program wouldn't benefit you. It could actually do more harm than good.
Thank you for both of your guys' input. I think you kind of already touched on this a bit, Dr. Adele, but I think the people, like we have a few questions in the chat, they saw that you guys had a little more, I guess, unconventional pathways, or you did a lot of very different things. So we had a lot of questions about making a distinction between basically your major and what you want to do in the future and what activities you should do towards that. So like Pauline asked, what would you recommend doing to get involved during undergrad for someone who is a psychology major but hopes to be a pediatrician in the future? So is there like a distinction between that? What activities would kind of meet both of those requirements, if that makes sense?
I think more and more med schools are looking for people who didn't just do biology pre-med, chemistry pre-med, because there are other things that you bring along the way into medicine besides just science. You know, besides I just did a whole bunch of labs and I just did my basic requirements. So when I see that someone is studying psychology, to me, that marries beautifully with taking care of children. And really, you're in a sense taking care of their parents and working with the psychology of a parent and a growing child. That's a fantastic understanding, a fantastic background to have. So, really, what it boils down to is, are you taking the appropriate basic science prerequisites to be able to sit for and prepare for your MCAT exam? And then, you know, as was already said, just making sure that you have some valuable extracurriculars. But just the straight path through biology, chemistry is not the only way to go, and it's just not gonna simply cut it anymore. So I think as long as those basic sciences are in there, it's fine.
I also want to add, whether it's going from undergrad to med school or med school to residency, you want valuable things, things you can talk about, things that interest you. So, like, if you are a psychology major, maybe you can do like some clinical shadowing of different specialties. Maybe you can do volunteerism within psychology as well, because when you're applying to med school, they have so many different categories. It's not just strictly clinical based. I mean, they want to make sure you have like some type of clinical science exposure, but that doesn't have to be all of your application. I remember on my applications, I was like in student government association, like I was in things like that. I was in honor societies. I did volunteerism. Those things that like you're passionate about, that's what you talk about during the interviews, whether it's like med school or residency. You're talking about things that you have on your application. And so if you are someone, like say for instance, interested in research, or you did a research project that you can't really talk about, I would be weary because they're going to ask you about the research project. And if you didn't do much or didn't really do anything with it or don't care about it, then how are you going to convey that to like an admissions committee who really wants to know about it? Additionally, I would say every summer, so I went to Xavier, and I will say, y'all, Xavier is very like strict with the pre-med. They're very strict with the pre-med. They're like, every summer of undergrad, you need to be doing something. So every summer of my undergrad, I did do something. So my first summer, I did, it was called SMDEP, but now it's called SHPEP, SHPEP. And it is programmed at medical schools all throughout the states, like from California to Yale to Howard to UTMB and Galveston. And they like pay you to go there. So I did programs that paid me to go there for the summer to get experience. And so that one is for freshmen, the summer after freshman year and the summer after sophomore year. So if any of you guys are in that period, you can look it up. They're at 11 different universities across the nation. And then my second summer, I did a study abroad in Tanzania, Africa, the country, and I did like a clinical intern. And then my third summer, I did a clinical and like MCAT program at Howard University School of Medicine. So there are so many people who want to pay you for your summers, like who are looking for interns, and they pay pretty well. Like some of the summer research, I think they used to be like $2,000 back when I was in undergrad, just to go like a summer to do some research, to get some experience. that can go in your application. So there's so many different summer programs that can help you realize, is this a career you really want to do? Because I don't think that part is talked about enough. Like, is medicine something you really want to do? It is a lot of delayed gratification. So if it's something you really want to do, get those exposures and make sure, because this wouldn't be something I would recommend for anybody who really isn't into it and kind of want to make a difference.
Thank you guys for all of your very detailed answers. I love how you touch on a lot of different points. I think it really did answer basically everyone's questions in the chat. They did have kind of similar questions. So I think we can move on to the next section. So we kind of started off about talking about medical school itself, and now we kind of want to address residency. And so I think as a starter question, and again, you guys can put questions in the chat and at the end we'll read them out. But to start off, what's something that you thought you were prepared for, but found maybe surprising or difficult once residency actually started? And you could set that off, Dr. Haydel, if you want.
So as someone who's finishing my first year, my intern year, I came into residency. So I worked before going to medical school. So I know what it's like to have a job. I know what it's like to like be professional. I know what it's like to get work done. Residency, the hours, that is something I don't think anybody can prepare you for. Like, I think I had an advantage of having like an understanding of like what a job was. Because sometimes that's hard for people. Like, you've been in school your whole life, so you've never really had a job. But like, I had a job, but I didn't have a job working 70 hours a week. Like, I didn't have a job working 14 days in a row. So I think that is, to me, the one of the hardest things about residency is that it's long hours. And especially like your first year is like, I don't know anything. But as the time goes on, like, I think about myself now compared to when I first started a year ago, and you learn so much. And you learn so much in a different way. You don't learn necessarily via textbook. You learn by patient. You learn by asking questions to your senior, by attending, like Dr. Gaffney Adams. Like, you learn from people around you a lot. But the hours, that's just my biggest thing. The hours, I don't think anything can prepare you for the hours.
Thankfully, it took me forever to do everything as an undergrad. So I was used to working long hours and studying long hours because I was a bit of a slowpoke. But I can remember as a medical student, like, I think for our sub-internships, we could carry a max of like 4 patients, but then you could like help your interns and senior residents. And I remember as a med student with my 4 patients and killing it in my sub internship, and being able to answer the questions and all that stuff, thinking, all right, I got this. If I'm going to carry 15 patients as a intern, I got this. I can do this. I can do this times 3 or 4 or whatever. Nothing prepared me for being the only person on the weekend, right? And writing 32 progress notes before the attending arrived at 9 o'clock, or for just certain experiences that are shocking, right? Nothing prepares you for your first code, no matter how many mock codes and simulated patients you do. The first time is always gonna be scary. You're gonna get there, and no matter how many rotations you honored, or that you passed your boards, or that you even made it into a residency program, nothing prepares you for getting there and feeling like, oh my God, I don't know anything. Holy crap. Who said I was a doctor? Who said it was okay for me to do all of this stuff? And as was said, right, all you could do is ask questions. You will know things and you will be anxious and you'll still want to double and triple check yourself. But it's a muscle that you just have to flex and flex and flex and work and work and work until you build that confidence, and it will come. And then it's going to happen again. You're going to get to the intern year, the end of it, and you're going to be like, I'm ready to be the resident. I can't wait. I know what to do. I'm tired of running stuff by these seniors. And then you're the senior resident and you're the one the med students and the interns are coming to ask questions to. And it's like, oh my goodness, it's happening again. And it keeps happening. It happens when you're an attending as well. So just know that you're not going to know everything. You have people to ask. You have so many tools at your disclosure. We had little tiny books that we would flip out of in our pockets, and now we have these smartphones. I did not start residency with a smartphone that had all of these things in it, and so the amount of things that I used to have memorized versus how little I memorize now. Like, I know the medicine and the core of it all, but how much I'm willing to not memorize a dose because it's not hard to find it anymore. It's pretty amazing. So, but it's a process, and the only way to get through it is really to just go through it. And, you'll learn as you go, and just always have mentors and always be willing to ask questions.
Yeah, thank you so much. I feel like it's really insightful to hear, both someone starting off in residency and someone that's finished, because medicine has a lot of stages going into the field. And you definitely have to see all those perspectives, which is why I hope this event is really helping you guys out. Um, I think before we go further in terms of like being a resident, and like I want to talk a little more about the match process and finding an actual program. So, how like competitive do you think the residency programs were, and how did you try to stand out? What considerations maybe are made during selection? Because I know a lot of us here might be stressed about, because like I said, a lot of our member bases are high schoolers actually, so they're currently stressed about getting into an amazing undergraduate school, an amazing medical school. But is that really like the biggest consideration? I think standing out can be in a lot of other ways, and we should have that discussion.
Um, I would say a lot has changed, even like my year with applying to residency. I try to look at things like as you move on in the system, unless it's something like very, very important, then it doesn't, not that it doesn't matter, but it's not going to be pertinent to your next stage. So everything I did in undergrad, I didn't put, I don't think any of that stuff on my residency application. I put like 2 experiences I had from like the period from undergrad to medical school on there, just because it was very pertinent to like what I want to do and how I approach medicine. But as you continue to go on, you'll start having way more opportunities and like different things that arise that continues to build your application. No one, the people knew about my undergrad just because of like the history, but that wasn't a key factor in me getting into like residency or I think when it comes to getting into residency, what's important is like your overall application, and then making sure that if you want to do something competitive, and usually the competitive things are like dermatology, orthopedic surgery, interventional radiology, med peds is kind of competitive because it's less programs. Triple board is competitive in the sense that it's only 11 programs, but also like making sure that you have what those programs look for. That's how you successfully match. Surgery programs, derm, things like that, they care a lot about academics. They care a lot about research. So when if that's what you're thinking, then your application needs to make sure that you hit those points or apply to something as a backup. Not to say that like you can't get it. It's just is like very hard and um very challenging to get into those spaces without having those accolades. And unfortunately, that's just kind of like how it is. If you're a DO, if you're an IMG, those are other factors that play into getting into residency and play into like where you should apply. What conferences should you go to? Should you do an away rotation? And for those of you who don't know, an away rotation is a rotation where during your 4th year of med school, you get to go to like an institution, you get to like see the people there, you get to see the city, you get to see kind of like, do you really like this place? Are they a good fit for you? And so last thing before I let Dr. Alexea take over is that you kind of go from this space of please someone accept me, like trying to get into medical school, to residency is like you are trying to choose them. And that was like the biggest like mind-blowing thing for me, because I was like, I just need one acceptance. I just need one acceptance to change my perspective and my narrative to say like, okay, I'm a great candidate. Who should want me? You know, you just start like popping your stuff a little different. You're like, who should want me? You know, like, what am I bringing to the table? How will this institution make me the best doctor? And I think that's something you don't recognize until you're in that moment because we're in this like fight or flight just to get to medical school, just to get through undergrad. So when you're finally at that end of the tunnel, it's like, whoa, I actually am a good candidate. Like these people should want me at their program, and then feeding off of that.
I love that, to go in with that sort of confidence, because it is important, because not just what you have to put on your application, all of the extracurriculars and the research and all of that, having had the opportunity to interview incoming residents as a chief resident, as a chief fellow, and as an attending, one of the things that really stood out is, how did people show up personally? There were people who were amazing on paper, and they were terrible in real life. And people who did not take seriously their sitting down to lunch with residents and interns, right? We had a say. There were, we couldn't say who was getting accepted, but we were asked, all right, we're gonna talk about all the applicants. We didn't know, I'm speaking from the perspective of when I was a resident. We maybe didn't know an applicant's MCAT scores or board scores, or we knew where they went to med school and what was their name, right? And they would say, based on your experience with the candidates today, we're gonna make 3 piles. Who is highly ranked? You would love to have them as your co-resident or intern. Who is, put them on the rank list, but they're not an absolute no, and who is an absolute no. And we always had an absolute no for the most seemingly random, but not so random things. We had one person who, took out their cell phone every opportunity they got. They didn't ask us any questions about the programs. They didn't pay attention at our noon conference that they were allowed to attend. We had someone who kept getting lost on the tour. Like we literally just kept losing this person in the hospital. We lost them like 3 times on the hospital tour. We had people who didn't ask any questions about the program. They just asked about like vacation and, weird social questions, like inappropriate questions, like, wow, this person can't even be professional through a 30-minute tour of a hospital and a 30-minute lunch. So beyond just what you've done as a medical student and as an undergrad, just also how you show up on the day you come in for the tour. I remember going to, it was my very first residency interview, and I was the first one to arrive, and I was in the conference room with the program director for like 30 minutes. I had no idea she was the program director because I didn't look at the website and all these different things. And I'm like, my goodness, if I had really wanted to go there, I really bombed that experience. I had 30 minutes face-to-face alone time with the program director. Like I should have capitalized it. I should have gone in there and, gave it my all, gave it my best, and, showed up as the person I could be. But I was like so stressed, so nervous. And all I did was show up in the room. And then I was just like, hi, I'm here. I'm interviewing today. And it wasn't until like the second half of the day where I sat down and had one of my interviews with her. And I was like, oh my gosh, like I gave the absolute worst first impression one could have given because I wasn't prepared to go through that process. So do mock interviews, ask other people, how you should show up that day. Don't wear a black suit. Everybody wears a black suit. Don't, you just blend in, stand out, but stand out in a way that is professional, in a way that is uniquely you, so that people remember you when it's time for these programs to put in their rank list, because they need residents. They want the best of the best residents. And as Dr. Tori said, they are trying to attract great candidates to their program. So it goes both ways. And then everything Dr. Tori said.
Thank you for talking about all that, it's actually great that you started mentioning interviews because we did also get a question in the chat from Diana about interviews. And I don't know if you guys ended up doing like virtual interviews, but she did ask if you guys can speak a little about how to shine on virtual interviews because it can be hard to professionally brand yourself in that setting. And I know, like Dr. Haydel, you said you entered medical school during like the Zoom time. So I don't know if that also applied with like residency interviews or how that ended up working out.
Yes, so my med school interviews during 2020, they were in person. So those two were like the ones I had were like in person. And so residency now, like it has changed. Almost all residency interviews are virtual still to this day. Some places are now offering like second looks, which should not have anything to do with like your ranking because it's like about availability, cost, and things like that. The reason they decided to do it from COVID is from a cost perspective. It took COVID for them to recognize that it wasn't as equitable for people maybe from like lower socioeconomic statuses or people who had like a lot going on at that time to like travel all across the United States for interviews. I can't even imagine having to do that. And so I think Dr. Alexea had a great point about professionalism, and that shows up everywhere. Like it could be rotations in medical school. It can be so many things. I had one of my classmates in medical school. He had interviewed for programs, but he basically had to drop out of med school, withdraw because he went on an away rotation and he was so unprofessional that the program reached out to my medical school. And so this is someone who had like multiple infractions throughout the years of like unprofessionalism, whether that's like arriving to test late, leaving for before we were supposed to be leaving. On like rotations, he had a Tesla. And so he was like, oh, my car is in charge. So just different little things like that, those things add up. And so like the final straw was like being on an away rotation. And mind you, you're at this institution, you're showing them who you are. And so I think his thing was like he went to lunch and never came back. And they reached out to our medical school. And because of that, this is someone who had went through the match, interviewed at places, was set to like do a rank list. He could not even do his rank list because he had to withdraw. So that just shows you how important professionalism is. And so being someone who did residency interview on Zoom, it's important to be engaged. They have a lot of things for you. Don't be like slouched down while you're on Zoom. Make your background like something nice or like something in the background. I wouldn't put anything in the background that you wouldn't want someone to comment on because people do comment on things on the background like, oh, look at that art or oh, look at this plant, things like that. And then I would say just be yourself. Like I wouldn't be too stressed about it, but I would just be yourself because a lot of the interview process, one, they're going over programming. And then they're like, the most interviews I had was 5 in a day, and it was like mini interviews, so like 10, 15 minutes. So that's not a long time when you think about it, 10 to 15 minutes. But on average, I had like three like 20, 25-minute interviews max. And so the rest of it is how engaged are you in the program? How engaged are you whenever they stop going over the structure, but they bring residents on? Are you asking the residents questions? Are you asking them questions that weren't already stated in the PowerPoint? That's a little give me. So if it's something you can easily find on the website or they mentioned it already, I wouldn't ask that question. I would ask something different about like their experience or what do they like or how is this rotation if you're particularly interested in it. But all it's about is showing up at a good time. You will have like your camera, I would say like shoulder width to head apart, a nice background, appear to be engaged. Some of it will be boring. I'm not going to lie to you. It will be boring, but don't look like it's boring. Don't slouch. I had one of my close friends, her number one program, we were on an interview together. Her number one program, she ended up matching her number two, but she had done so many interviews virtually. Zoom fatigue is real. She had did so many interviews that this is her dream program. We're on it together. She was slouched down, looking so uninterested. Like if she wouldn't have told me herself that that was her number one program, I would have never thought that because she didn't appear to be interested in the program. So that's very important, like how you appear to those looking at you.
I think it's really great that you mentioned all those personal stories because when it comes to like entering the medical field and going through all of these different stages, I feel like a lot of us feel like it's very tentative and it can be very hard to know what you should and shouldn't do. And it's like, you've been working so hard up until that very moment. And it's crazy that just doing this and like slouching kind of might have been like the main reason that she didn't end up matching with her number one choice. So, Dr. Alexia, if you want to speak on that as well, you can.
I think Dr. Tori really covered it. But just, get dressed, right? All the way down, not just the top half of your body. You never know if you have to stand up, step away and get something, be well groomed, be awake and alert. Of course, you don't want to be drowsing off or dozing off. And know something about the place. And really ask questions in a way that shows that yes, I know some things. I took some time to do the research, but I was also paying attention. I'm not gonna just ask some rando cookie cutter question just for the sake of asking one. You want to be engaged. You want to ask questions that encourage conversation because folks are trying to get to know you. And for, us old folks who didn't grow up with all of this, it's awkward for us and we have some Zoom fatigue, but also some of us aren't great with the technology. And the more comfortable you are, and the more engaged and connected you are, the more engaged and connected your interviewer will be, and it will open up opportunities to share things about yourself that will put you over the top, because sometimes all of the applicants are so great but they can only pick 10 or 30 applicants, and it's like, how do you set yourself apart? You set yourself apart by being someone people really would want to work with, and we were always told, like, if you're really great on paper but you don't show up so great in person, you might actually ruin your chances by going to do a second look where you're not in this crowd. Or if you're, not going to go and be stellar at the away rotation, don't ruin your opportunity with this program you love if you're absolutely fantastic on paper. Like, let them continue to believe that you are a rock star if you're a little socially awkward and you can figure it out when you get there. So you have to know those things about yourself and really make a judgment about, where you're going to invest extra time, energy, etc. But also just when you're fully dressed on Zoom, it comes across in how you show up. I can remember when we first started this whole land of Zoom, I would be like all business and get fully dressed because it made me feel like I was doing something other than wearing scrubs and, schlepping through my office and doing COVID rounds and all of those things. And how you prepare yourself, it comes across that screen. So just be mindful of that and don't take the little things for granted. Put on the makeup, get the fresh haircut, get your hair done, look like you would want to look if you were getting on a plane, traveling all the way to meet people in person like we used to do it. I'm grateful to hear that med students and undergraduates don't have to come up with that money to go fly places and do those interviews, because a lot of us were limited just because of the finances of it all. So that's amazing for you all.
Oh, one
Well,
thing I wanted to add about showing up and just like being interested. So this is a little quirky story. So I came to Cincinnati Children's for an away rotation. I did their triple board away rotation. And one day on my rotation, the day before, the general pediatrics program had like a Zoom, like an interest for people who are interested in the program. So the program director, Dr. Sue Pointer, short haircut, the day before, the next day, I'm walking on rounds. I'm with like one of the psychiatrists. She has a mask on, and I stop her. She's like walking in the hallway, and I stop her and I said, "Hi, are you the pediatric program director?" She literally took my badge, and was like, "Yes, I am," and like looked at my name. And so I was like, "Oh, nice to meet you. I thought that was you." I was on the Zoom last night for the pediatrics program, and she asked me, she said, "Are you applying pediatrics?" And Cincy is different, and you only could apply like peds or triple board. And I was like, "Oh no, I'm applying triple board. I'm here on the way." And she's like, "Okay, nice to meet you." When I got here for residency at one of our like welcome events, I met an APD, and she literally told me, she said, "I knew about you before you came because as soon as you met Sue, she came up and told me, I just met Torhiana and she's gonna match here." So that's just to tell you, like, I didn't even know that. I learned that whenever I got here at a welcome event, and I was just shocked. Like, I really was shocked about how, like, little interactions like that go a long way. For the program director to go up and tell an APD, an associate program director, that she met me and that I'm going to come there. Somebody who's not even in the general pediatrics program, that just shows you being personable, remembering little small things, having small conversations can go a long way. I was really kind of nervous because she had like pulled my badge and looked at my name, but that was her way of remembering. And so those little things can make or break and make the biggest difference. I mean, if I wouldn't have spoke, it wouldn't have made a difference, but me speaking and just saying hi, hello went a long way.
That's actually crazy that you mentioned that. I think the biggest thing, like because we were asking a lot about like interviews and kind of the things that might not seem like they matter, is that everything matters when it comes to applying to anything related to medicine. And it gets way more meticulous than one might think. And I think I really liked that you shared a story. So do you guys maybe like transitioning from actually matching with the residency program, do you guys have any like standout experiences as residents that you would like to share? Maybe something that left like a deep impression on you and or like made you change your approach in any way? Because I think it really is a learning process up until the very end, and that's kind of the point of, you know, being a resident before going straight into practice.
I think one of the things that has always stuck with me as someone who was growing into becoming a doctor, I had the experience of navigating end of life care and healthcare with my grandparents just prior to entering med school. And then dealing with my own health issues and experiencing really terrible health care, going to seek the opinion of healthcare professionals and leaving with the exact same questions and anxieties that I had come with. It was always something that I knew I would not leave a patient with, and I'm still that way to this day. So as a med student and as a resident, I always took the time to fully explain things to my patients. And during that time, you do have a lot of time, right? You do your morning rounds, you do rounds with the team, you learn. And then in the afternoon, if you're not admitting or doing procedures, you're really just going back, checking on your patients, following up labs, imaging, and helping them understand what is happening. And what happens is you have all the time in the world as an intern, or at least compared to being an attending, it feels like you had all the time in the world. And the same is true when you're the senior resident, when you're not the one writing the 15, 20, 30 progress notes. You're just leading and guiding the team, but also learning as you go. You have such an amazing opportunity to go speak to your patients, know them on a deeper level, help them understand, and you get good at practicing delivering news, how to educate patients, how to speak the patient's language while still speaking medical. And then over time, you learn how to bring that down into something that is concise, but still allows people to feel seen and heard, and feel that their needs are being met. Um, and that's important. And I would say that is the thing that sets me apart from my colleagues. It is the thing that has patients, keep coming back to me or asking to see me specifically. It has my patients who may be coming to see me for an infectious disease consultation circle back and say, oh, I just found out you do primary care. I'd like to transfer my care here because I don't get this same experience elsewhere. But that's a muscle you build, and it's a practice, and how you show up in the beginning is how you're going to show up in the end. If you can do all the things that it takes to just get the work done, and you can appear stellar to the people around you, and to your attendings, because things are always done and things are always efficient and just so. But at the end of the day, in the real world, yes, patients want you to be efficient, but they want to feel seen and heard. They want their questions answered. They want to leave your office feeling different than when they came in. And you're not going to wake up as an attending doing that. You learn that as you go, and you will continue to carry on that way as your time as a practicing physician goes on.
Thank you so much, you guys, for being here. We're kind of reaching the end of our time here. Avi, you can go ahead and close this off.
All right. Do either of you guys have any closing statements you'd like to leave the audience with right now?
I just want to say that this is your journey. How you get to the finish line, it might be uncomfortable, it might change, your decisions might lead you to something else, but make sure you're doing this for you. Make sure you're doing this because you can't see yourself doing anything else. If you would have asked me when I was in high school, would my journey look like this? I would 100% tell you no, but I'm grateful for the lessons. I'm grateful for the obstacles, and I'm grateful for my experience that I was able to bring and continue to be able to bring in medicine to treat my patients and talk with them. So just remember that on this journey to medical school, sometimes it might be a linear straight path. A lot of times it won't be. As long as you keep pushing and get to the end, it'll all be worth it.
Thank you so much.
I would say, just as you continue to go on, don't lose yourself in this process. I, did everything. I went straight through. I got married at the end of my residency, had a child at the beginning of my fellowship. And I remember when my daughter was born, I had my dad bring furniture from my teenage bedroom to put in my daughter's nursery. And in that furniture was an intact drawer that had not been opened since I was in high school. And at the time, as a married woman, as a new mom, and as a doctor, I'm opening this drawer, and in this drawer revealed so much of who I used to be. Paintings, drawings, sewing projects, all these things that I used to love to do. And like, if you had asked me as a fellow, like, who are you that's not a mother, that's not a wife, that's not a physician, who are you? At that time, I wouldn't have been able to say, I'm an artist, I'm a painter, I'm a creative. I completely forgot these are things that I used to do and love, and I'm slowly finding my way back to that. So I would say, as much as this process is amazing and wonderful, don't lose yourself in the process. Remember who you are, remember why you started this journey. And then also, when you pick a specialty, pick something that you want to get out of the bed and go do every day, no matter how crappy a patient or patients treated you the day before, no matter how stressful the days or weeks were before, because it's hard work. It never stops being hard. It's just, what is hard is different over time. But the fact that I love what I do, most days, even if I snooze my alarm and go back to sleep, I do wake up before my alarm. I wake up looking forward to seeing certain patients on my schedule every day. And there's going to be a small handful of patients that keep you showing up for everybody else. So because it's shifted and off balance in that way, make sure you're waking up and doing something you love, so that you keep showing up every single day for yourself and for the people you get to serve.
All right, thank you so much. This conversation was amazing and so inspirational. And as you can see in the chat, everyone is so grateful for you guys to talk with us today. Thank you guys in the audience for your interactions. And yeah,